I'm Tamera Schille. I'm a pediatrician and I work at farm workers in Grandview, Mountain View, and Sunnyside, and I'm also the medical director for those 3 clinics. I was in Peace Corps for 2 years, and that was, for me, a real changing experience for medicine. It really emphasized preventative care. It really emphasized how much cheaper it is to do things beforehand than to wait till something's bad. Working at farm workers is basically like getting to do international health with first world resources. We try to be an access point where everyone can come in. It doesn't matter if you have money, it doesn't matter if you have insurance. I think that's a huge issue because if you're sick, you can't work. If you're sick, you can't go to school. If you can't go to school or work, you don't earn money for your family, you don't graduate. It's a self-fulfilling cycle of poverty. And keeping people well is the first step, keeping them able to lead fulfilling lives. I like doing community health. It's not where you're going to make money. It's not where you're going to have an easy life. It's not where you're going to have short hours. But you can at least feel like you're being really fulfilled by doing it. I have a real high percentage of high-risk kids in my population. My job as helping them not go to Seattle 25 times a year, maybe helping them go a lot fewer times, and me being a coordinator and trying to keep them as well as possible. So they're out of the hospital as much as possible, so they're in school as much as possible, so that they can do better and go on and live their lives and be as productive as they can and as happy as they can. I always look before I go into a room, and I always memorize whatever names it is, even if it's new patients, before I go in the room. And I try and remember one thing I said about them last time. So when I walk into a room, I say, "Aren't you the one that got the toothpick in your foot last year?" And to them, that just means I'm theirs. You know, I cared enough about them to remember that, and I cared enough about them to make sure that it got better. I feel like people really have a big interest in, do our patients get well or not? And that's huge. I mean, you got to work somewhere like that if you're going to feel like you're fulfilled.